succinct, I think, and fairly rapid through this. But of course, do please let me remind you as chairman that it does not diminish any director's opportunity or right, of course, to speak outside of this board meeting, should there be anything else they want to just pick up on. Okay, so where we are at the moment is we are at item 10. So we're doing fairly well, but we do need to try and do this business now in 20 minutes and then prepare ourselves for a closed meeting. I'm conscious this is an open meeting, of course, but of course at that closed meeting we are going to talk about our role in the wider system going forward, and that's going to be a very, very important work and debate for us all to have. So that's what we're up to. So may I bring your attention to item 10. Paul, I began this meeting by thanking you and Sarge for the production of this report and reminded director colleagues of how important our prioritisation of patients with learning disability can be, given their particular vulnerability that we're aware of at the moment. So may I turn to Sarge and Paul in the first place and ask if there's anything from the reports that they would wish to bring to our attention in terms of delivering a unanimous board decision that we took in July. So Sarge or Paul? Sarge first, is it?
Thank you, Max. Yes, I'll just quickly introduce it and then pass over to Paul. Can I just check very quickly, because I can't see Paul on screen, whether he is actually... That's right, brilliant. So Max, yeah, as you've quite rightly highlighted, we know certainly from reports more recently coming out the impact that individuals with learning disabilities have in terms of health inequalities and outcomes. As a result, in its July board, we took a decision as a board to prioritise individuals who were waiting treatment up into on the waiting list to the top of their priority. So if somebody was a priority 2 on the surgical wait list, that we would bring them to the top of priority 2. And of course, in order to enable our systems to do that, we needed to do a significant amount of work on our EPR. We needed to work with our clinical teams, and we needed to work with operational managers well in terms of ensuring that our systems and processes aligned in terms of being able to recognise those patients that are coming through for treatment. What this paper tries to do is give you a very quick overview of the work that's been undertaken, and as a result of that, the impact that we're having. By no means is this work complete. This is very much a progress update. So I'll hand over to Paul at that stage just to quickly take us through some of the work that's been done and the next steps.
Thank you, Sarge. Paul, thank you.
Thanks, Max. And yeah, I mean, again, just for the purposes of brevity and the assumption that colleagues have read, what it details is a process where engagement of the relevant parties, if you like, a requirement statement from that. So how will we alter the EPR and where will we alter it in terms of the workflow to ensure that we have maximal impact in respect to this? An underscoring of that by doing it twice in the context of how functionally people use the EPR in the context of creating and managing waiting lists. A quality assurance step where the lead nurse for learning disabilities then looked at that data to ensure that, and this is a standard pattern actually, we find that if we shine the focus on data quality in any context in the organisation, what occurs is that we go from a famine to a feast, and then you need to do a QA piece to make sure that everybody who's thought that they were ticking a box with good grounds has actually got those good grounds to do it. So we have that quality assurance step overlaid in respect to that. And then ultimately the question asked is, has it made a material impact on the time and duration of wait for these individuals? Because that was the motivation from the board's perspective in the first instance. And subject to the law of small numbers, the fact that your baseline and then the position you find yourself in are not necessarily directly comparable, I think we can confidently report to the board that in comparison to the rest of the waiting list population, there has been an average decrease in the wait associated with people with confirmed as having a learning disability. So that's all that I really wanted to to pick up as Saj has flagged. I'll try that again. As Saj has flagged, the opportunity to understand the characteristics of this population in greater detail is something that we will continue to work on. The other aspect, almost looping back to Mel's summary of the planning guidance in totality, is that there are various provocations and challenges for us as a provider, including to look at this thing called Core 20+5 and understand how we respond to the overall challenge around inequalities in relationship to our management and delivery of our services, of which waiting lists would be a key but not exclusive component. So that's all I wanted to say, Max. I think we've followed a process. We've engaged the colleagues who know how to make these things happen. They've worked collaboratively, and we've got hopefully an outcome that the board recognises was entirely the purpose that we engaged on this piece of work to begin with.
Thank you very much, both to Saj and Paul. Of course, we exist, at least in part, to tackle inequalities in health, don't we? So I'm really delighted to see this. Thank you. May I ask whether there's any further questions or detail required of directors? And thank you. Yeah, Ray, I'll bring you in, please. Yeah.
Thanks. Just very briefly to add to the discussion. So just from a medical examiner standpoint, of course, all deaths in patients who were known to have a mental illness or a learning disability are identified separately. I think this will really aid that process. Just from the reporting that we've had back over the last few quarters, for the previous 3 quarters, we've had 5, 6 and 3 patients who fall into that category identified, and for the quarter just gone, so Q3 of 21-22, we've had 15. So I don't think there's any reason to think that that is an actual spike in numbers of patients with mental illness or learning disability. I think that's just a better identification, which is obviously really important. So it's another benefit of this.
Thank you very much, Ray. And I began this meeting actually talking about, I think I may have said HSJ paper, it's a BMJ paper I was referring to, which describes brilliantly the additional vulnerability of people with learning disabilities nationally. It's a England and Wales study. ×5 admitted to hospital, ×8 likely to die compared with the normal population. So I'm delighted to see directors and us as a board, of course, focusing on supporting these people that come to us for help. Thank you, everybody. Julie, may I just ask whether, obviously it's great the board have been briefed on this, but is this something perhaps that the Finance and Performance Academy might just take a look at in the coming months to see how progress is, please?
We can certainly do that, yes, so we can add to our work plan. I don't know if we would see that quarterly. I'd let Saj suggest and Paul suggest the kind of frequency at which we do that. Yeah.
Julie, very happy for you as chair of that academy to determine the appropriate frequency in discussions with Saj and Paul. But I was conscious that I'd like it to be something that just we have an eye on as to how we're doing with it. And as I say, again, well done to the colleagues who are promoting this work. Thank you, Saj and Paul, for that. That's great. I don't think there's any other questions. Julie's agreed that, Performance Academy can keep an eye on how progress is with that. So that's great. Thank you, everybody. Moving on to quality. Shall I now turn to Janet, I think in the first place, Janet Hurst, and of course, Mohammed and Ray and Karen, for anything they would wish to bring to our attention from the work of the Quality and Patient Safety Academy. So I think Janet first. Is that okay, Janet?
Yes, thank you very much. So we've had quite a detailed paper, which I'm sure you've read. So there's quite, hopefully your questions are here and answered. So the recommendation is for the board is to note the discussions and the outcomes from our meeting. There's no new risks to flag for you, and there's no new matters to escalate to the board. I think it is important to note the items of positive assurance learning and areas of improvement, because we had some really good discussions. So we had the service presentation, as you can receive, covering dietetics and the challenges and the innovation and the stretch to international perspectives in that space. We received details about the presentation from the new medical examiner, and we're quite struck by the enormity of this structure and service. So inevitably there'll be more reports to follow and learning of how that process is benefiting families. We had the inpatient survey and detailed plans for improvements, and we noted that this data didn't shine the light in the way that many people in the trust are actually working, and we need to triangulate it with other data so that the steps taken are balanced and more comprehensive and have diversity of input and thoughts. We had the extensive digital biannual report, and apologies because I probably didn't provide enough time, because it was a very, very detailed report and worthy of more time and attention. And we had details, transparency about infection prevention and control board assurance framework to reassure those at that group that steps are in hand to manage risks. Our next meeting is next week to pick up on actions, and in the current climate, we have postponed the training that was planned for February. And Mohammed, you're actually the chair. I deputised on the first occasion, so thank you everybody for your support. Mohammed, are there things that you would like to add?
Thank you, Janet. And other than to say thank you so much for chairing in my absence, that was greatly appreciated. The only thing I'd perhaps add is that we were hoping to have a development day in mid-February that we've been planning for quite some time for the Quality Academy. Unfortunately, Omicron has got in the way of our best laid plans, so we've deferred that for a future date. That request came in from Ray, and something that we've had to agree to, because I think the quality team have been redeployed to other activities, quite rightly so. So we'll reschedule that and get another date.
Thank you very much, Mohammed. And Ray and Karen, would there be anything you would wish to particularly raise with fellow directors in relation to the Quality Academy's work, please? No, that's fine. No, thank you both. That's fine. Okay. So may I ask whether there's any questions? And thank you, by the way, to the comments from Sugra and from Karen in relation to our last item on our work on learning disabilities. Well done all, and thank you for the comments. I don't think there's any further information required of Janet's really helpful briefing and Mohammed's additional items. Thank you. So we're content, I think, to be ensured by the report from the chair of the Quality and Patient Safety Academy. Thank you, everybody. And may I turn to item 13, please? And Karen has helpfully, I think, circulated some slides, Karen, but would you wish to say anything to fellow directors in addition regarding the vaccination programme, please? Thank you for your leadership on this.
Thanks. No, Chair, I think we've picked up the stuff around staff vaccination earlier, and the slides that I've sent to Laura Parsons to be circulated show the place-based position as of the 17th of January. So that's the latest update at place.
Thank you very much, Karen. So again, I'll just check. There's obviously some additional information to read there, helpfully provided by Karen. But is there any questions on the vaccination programme? We've obviously touched on it throughout the course of the meeting, haven't we? So, yeah, I don't think there's any further information required. And of course, we know where to go if any director wants further information. Thank you very much, Karen. That's extremely helpful. Thanks. Okay. Shall we turn briefly, please, to, by the way, we have managed to win 10 minutes or so from our colleague who is joining us at noon. We just asked, look, it's 10 past okay. And so we've just managed to buy a little bit of time, but I won't waste that by talking myself. And I'll turn at item 14 to John and just ask John whether there's anything he would wish to bring to our attention, please, from which we've all read, the board assurance framework, the high level risk register and the movement log. John.
Yeah, thanks, Max. So we can, of course, take these papers as read. The cover sheet explains what the three appendices are. You've got the board assurance framework. All of the assurance levels are the same as they were last quarter, and the rationale for that is in the appendix, Appendix 1. Appendix 2 is a list of all high-level risks 15 and above, sorted in descending order. So that's a slight change in the format, but it's a complete list of high-level risks 15 and above. There are 6 scoring 20, 10 scoring 16, 10 scoring 15. And again, we're going to do some work on the formatting of that, but it's all there for you to see. And then finally, we've got the movement log. which is self-explanatory. It tells you what's closed, what's new, what's changed in score. We do have a risk workshop coming up for the board, which is on the 9th of February, when we'll have the Good Governance Institute alongside us. Amongst other things, it's an opportunity for us as a board just to talk about risk appetite and what that means. And because one of the things we sense is that we use these terms and we look at this stuff, but it isn't always as easy to kind of interpret and understand, and it's not always clear that we bring the same kind of perspective to it. So it's an opportunity for us just as a board together to get a shared understanding of how we want to look at risk, the terminology we use, simpler presentations and so on. So a great opportunity. Happy to answer any questions on any of the material you've got there.
Thank you very much, John, and thank you for your correspondence to fellow directors regarding the corporate strategy, which is clear as well, so much appreciated. May I ask whether anything has arisen in the board assurance framework, the risk register or the movement log that anybody would require further detail or questions on, please? No, content with the papers, and again, in the spirit of just trying to get to the end of our meeting today, in the context we're in, we know that John's available should be any queries regarding information in there. Thank you very much. We are assured. Much appreciated. We move to section 5, which is governance. And those of us that were at the Charity Committee have approved an ISA 260 draft annual report and accounts and letter of representation. But I think, am I right, Matthew, that you would wish to bring that to board's attention and invite board to, having read it, approve the documents? Matthew?
Yes, that's exactly correct. Thank you, Max. So they've been through, the draft accounts went through the Charity Committee in July, subsequently being audited by Deloitte, and then a further run through with the Extraordinary Charity Committee in January. They've been through the Audit Committee and are now here for today for approval by the Board of Directors, who are ultimately the trustees. The ISA 260 is included in the reporting pack detailing the findings and the process undertaken by Deloitte, but nothing to report in terms of any escalation to the trustees. They do highlight a few recommendations that we'll work on throughout the next reporting period, and the pack also includes a letter of representation for us to sign off in terms of the overall pack that we send back to both Charity Committee and back to Deloitte in terms of letter of representation. So the recommendations are approval of the 2021 accounts, noting the ISA 260, and approval to sign off the letter of representation here today.
Thank you very much, Matthew. So, colleagues, it's full director sight on this, of course. Did anything arise that anybody would wish to ask further detail of, or any questions about, please? May I take it that you've read it and that you approve of the documents as published or as shared? Yeah. Yep, there are no further questions. Matthew, thank you for the preparation of those and the brief summary. That's really helpful. And approval is given, I think unanimously. I think we can fairly say by board. We can indeed. Thank you. Okay, there being no other business, I think we've come to the end of our meeting. We should reflect on whether there are any issues to refer to board, committees or academies or elsewhere. I think that's happened during the course of the meeting indeed. An example may be the learning disability progress, so that planners and performers will look at. But we've talked about that during the course of the meeting. Does anybody else want to raise anything with me or with fellow directors that have arisen in the meeting that they feel should be directed anywhere, escalated, etc.? It would appear not. I think we're content with the business that's been undertaken. Thank you very much. So, a slightly imbalanced board meeting, of course, but I'm delighted that we gave so much time, actually, to the people agenda this time. So I think that worked quite well, and the level of debate and quality of content discussion was terrific. So thanks, everybody, for your contributions. We meet again as a board on the 10th of March, 2022. We commit together, of course, to doing the best we can for the people of Bradford. So we express our thanks to all our colleagues for everything they're doing in trying to save lives and keep people healthy. So thanks, everybody. And I think that's reflected in the type of discussions that we've had here today. So I will close this meeting now. I was pleased to be able to bring the annexes to your attention as well, please. There is some really good reading and information in there. Okay. So we'll close the meeting now. It's the end of the board meeting. We are going into a closed board meeting, which we will start promptly at 10 past noon. Okay, so at 10 past 12, we just said to Mike, would you just give us 10 minutes? And of course, that's partly so people can get their head around the board business and now thinking about where we're going as an integrated partnership. And so that's what we're going into. But thanks everybody for, again, a terrific full attendance and the level and quality of content provided. Okay, I will close the meeting now and I will see you at 10 past 12. Okay, thanks everybody for your attendance at this board meeting.